white, yellow, brown. Ladies, what does your vaginal discharge mean? On this episode of the Purity Afya Show, we talk about the vaginal discharge, what's normal and what's not normal. To help us with this conversation is Dr. Edward Sam. He's a renowned gynecologist based here in Nairobi, Kenya. My name is 𝗪𝗵𝘁'𝘀. Thank you, Dr. for joining us. So let's talk about what a normal discharge, a normal vaginal discharge should be like. Yeah.
Well, so the normal discharge varies from one part of the cycle to the other. And usually during ovulation time, it's more clear and stretchy. While at the other times, it's not as stretchy and it's less in amount. So some ladies are able to tell when they're ovulating just by the amount of discharge.
So when you're ovulating, it's more?
It's more, and if you try and stretch it, then it stretches more between the fingers. Because for some ladies, they need to know that as they plan to try and conceive, because that's when they're more fertile. The rest of the time, it's less in amount, doesn't stretch as much. That's when they can tell.
And it's still clear.
It should be clear.
Yeah, but we've seen some women have white discharge, brown discharge. Maybe you can also tell us as an expert what are the discharges that you think that the color of the discharge that this is not normal, because from what you think it should only be white and stretchy.
Yeah.
Yeah.
It could be clear or slightly white.
Yeah.
So if now it's white and thick and the quantity is more, and especially if it's accompanied by itching of the vulva, then that's usually yeast infection. And some ladies get that before the periods or after the periods, or if they take antibiotics, or if they're pregnant. So yeast is something we see quite a bit. Then we have the infections, the serious infections like chlamydia and gonorrhea. Usually those occur when a lady has been exposed to an infection after intercourse, and usually that is usually yellow and purulent and foul-smelling, and can be associated with pain on passing urine. And so if a lady has that, and especially with some low abdominal pain, a bit of fever, then we could think maybe she has gonorrhea or chlamydia. Since the tests are not as easy to do, we treat them if we feel that they have symptoms of gonorrhea and chlamydia. We call it empirical, meaning the infection, we don't have to do the test to confirm, but we give them the treatment for those infections because they have serious implications.
So Doctor, generally which colors, because it should be clear and stretchy, so which colors should concern a woman?
Yeah. So yellow, maybe like pus, purulent, foul smelling. That is generally chlamydia or gonorrhea. Sometimes when it is whitish and fishy smell, then that is usually what we call bacterial vaginosis. Especially after intercourse, if a lady finds that the smell is slightly fishy, a fishy odor, then that could be bacterial vaginosis. That's also a type of infection which needs treatment.
Yeah.
We also get brownish discharge. At times, if it's somebody who's bleeding a small amount, the blood can turn and become brown. We also have foul-smelling, watery or bloody discharge with cervical cancer. So the odor is also important for the lady to note, so that if they're getting a discharge which is quite foul-smelling, they need to be examined so that we know what's going on.
And there are these conditions that are, like you say, that are linked to discharge in a woman. For example, we've talked about, let's say, yeast infection. We've talked about gonorrhea. We've talked about syphilis. Which causes? Is it the man because it's after the intercourse, or?
Yeah, so we have sexually transmitted infections.
Yeah.
So those only occur after intercourse to somebody who has the infection. And a lady can be able to tell that maybe it's a week or two after intercourse that she gets the symptoms. Then when we hear that history, then at sometimes we treat to avoid her getting complications of those infections. For example, chlamydia and gonorrhea block the tubes and cause infertility. It's one of the commonest causes of infertility. So we like to treat to make sure that we get the infection before it causes damage. While yeast can be irritating, it doesn't cause too much damage, but we like to treat it so the baby is comfortable. And there are various medications that we use.
Yeah. So when should a lady see a doctor?
Yeah. So anytime the discharge is in a large amount and foul smell and an abnormal color, especially if she's had intercourse and probably thinks she could have a sexually transmitted infection. Also, if she's itching, scratching, and gets a discharge which is like curdy, white, like 𝗪𝗫'𝘶', then that could be yeast infection. So we treat that also. Sometimes we also want to have a look ourselves because sometimes a lady might say that it's foul smelling but we don't smell. She might just be too sensitive to the smell, but when we smell we don't really. So we can reassure her that it's nothing serious. And then also if it is something serious, then we're able to treat it.
The normal discharge, because sometimes like I've seen on TikTok where ladies are asking questions, why is like my discharge bleaching my panty, for example? Is it normal?
Well, like for yeast, for example, it does change color when it comes out. So it might stain the panty. So if it does, then we would want to check.
So the normal discharge should not bleach your.
In some certain situations, it could maybe stain a little.
Yeah.
So again, we would observe and see if it clears. But if it persists, then we need to check the lady.
Are there some group of women that are more vulnerable?
We do find in certain climates, like when it's very hot, we get yeast more. Pregnant women get also yeast more. And then the sexually transmitted infections would be in those who are sexually active, and you need to look out for those.
So clearly, Doc, as you wind up, your vaginal discharge speaks a lot about your health. So what should women do in terms of precautions so that they ensure that they are okay, like the discharge is okay? Because when, for example, it's whitish, you have a yeast infection, if it's foul smell like you're saying, then it could be something serious. So what should we be doing?
Yeah, so there's the usual checkup if it takes more than a few days. Yeast infection can clear on its own. Some of the other discharges can also clear on their own. But if it persists, if it's associated with other signs and symptoms like smell, pain, then we want to assess. Anything which is persistent, foul smelling, watery, bloody, could be cancer. And so also we want to check. In older women, after menopause, if they start bleeding, then we also need to check and assess for cancer.
And as a woman watching you, they're like, okay, I have a discharge that is not anything that you describe like clear discharge. What can they do?
Because usually a lady would have known how her discharge is over the years. Anything that is out of the ordinary, suddenly coming up, then we would usually want to have a look.
Okay, ladies, I hope you've learned. I hope you've known when it's not, actually I've learned a lot today. When your discharge is not clear, then please, it's time to get medical checkup. Thank you so much for watching. Thank you so much, Daktari, for enlightening us on this. So please share with a sister who might need this. Not who might need this, because every sister needs this, because your discharge really says a lot about your health. Thank you for watching. Remember to subscribe. Just hit on that notification bell, because when you do that, it means you will not miss on any of our episodes. My name is 𝗫𝗫𝐿.